Thank you for joining us today. Today's presentation is for educational purposes only and not provided as consulting, coding, or legal advice. This video addresses post-operative services by the same physician performing the surgery. This is a complex topic and may not be all-inclusive. Please check with your major payers to ensure you are following those specific guidelines. Unrelated procedure or services provided by the same physician during a post-operative period can be billed by reporting a modifier. The two CPT modifiers are used during the post-operative period of a surgical procedure but not included in the payment for surgical procedure are Modifier 79 for an unrelated procedure or service by the same physician during a post-operative period and Modifier 24 to report an unrelated E&M service by the same physician during a post-operative period. The provider may need to indicate that the performance of a procedure or service during the post-operative period was unrelated to the original procedure. This circumstance may be reported by using Modifier 79. Don't use Modifier 79 for repeat procedures by the surgeon on the same day. Report Modifier 76 instead for that. Modifier 24 is reported on the claim for an unrelated evaluation and management service by the same physician or other qualified healthcare professional during a post-operative period. Documentation should clearly indicate that an evaluation and management service was performed during a post-operative period for reasons unrelated to the original procedure. This circumstance may be reported by adding Modifier 24 to the appropriate level of E&M service. CPT code 99024 is billed at $0 amount on the claim to report a post-operative follow-up visit normally included in the surgical package. Code 99024 indicates an evaluation and management service was performed during the global period for reasons related to the original procedure and applies only to surgeries with a 10 to 90-day global period. Why report 99024 when it is a $0 amount? It is important to report this code for quality of care purposes. Basically, the visit can be in person, and most payers allow the visit to be performed via telehealth. Payers want to know that appropriate follow-up is being performed after surgery. Payment for these visits was included in the global surgery reimbursement fee. Since July 1, 2017, Medicare requires 99024 to be reported for post-operative visits when the provider is practicing in one state listed above and is from a group practice of 10 or more. Even if your practice is exempt, the Centers of Medicare and Medicaid encourages use of 99024. National Medicare's website has a page dedicated to global surgery data collection, listing codes which require reporting post-operative visits. Also included on this page is access to the physician fee schedule lookup tool, evaluation and management visits, and many other wonderful resources. Medicare guidelines can be found on your MAC website and the Internet-only manuals on cms.gov. Medicare Claims Processing Manual, Chapter 12, and reference the items in Section 40 as shown above.